Doctor?
Brilliant, sir. Hey, Horst, thank you. I'm really sorry. I think I'm a bit not tech savvy here. This is my first time using the Google party. I would have been comfortable with the Zoom, of course, but never mind. We've got Richie helping me at the background, who's going to change my slides. So today, please don't change the slide yet. I'll let you know, Richie, please. So I'd like to talk to you about a very important topic, which is not actually discussed very much, and I'm not sure how much people are aware of it. And we take care of our face, we take care of our hands, we do a lot of things to our upper body, but you know, our dear old foot, who takes the whole weight of your body. And you can imagine if you are a 80 kilo or a 70 kilo person, and if you multiply that by 10, that is the gravitational force. That is the amount of force that goes through your feet, both your feet, and it's a small surface area. And that amount of surface area, if you look at the stress, force divided by surface area, it's a lot of force, stress that goes into the feet. So that's why taking care of your foot and being aware of the issues that can come in your feet, especially in diabetic people, I thought it would be very important to discuss about it. So that's what diabetic foot is. I'm Dr. Sailaj Ranjitkar, and I'm one of the orthopods here. Let's go on to the next slide, please. So what is it's a small little definition. It's a very simple thing to consider what diabetic foot is. It's a diabetic patient's foot, obviously, associated with neuropathy. Neuropathy means that nerves have been injured. Ischemia means the blood supply has been affected. So diabetic foot, you can have nerve injuries and you can have blood supply problems, or you can have a combination of both. So if this gets affected, then there can be infection in the skin, can lead to ulcers, and tissue can gradually be destroyed. So that's what diabetic foot is, and that's what we're going to talk about today. Can we go on to the next slide, please? So the first important thing is to consider what causes it. What are the contributing factors? So there are basically, to make it very simple, there are 5 things that we have to, that is contributing to how this problem in a diabetic person starts off. One is the blood supply. Second is the nerves that we are out there, or it could be a mixture of both. It could also be because the diabetic patients are prone to infection, their metabolic causes, and as diabetic patients must have felt it themselves, that the tissue becomes stiffer slowly over. It's called hypomobility. So I'll be discussing about that and talking to you gradually why this problem actually occurs. So now if you look at the vascular part, that is blood supply. You have a blood that goes from the heart down to the leg, and that's an artery, and something that brings the blood back to the heart. That's a vein. So that cycle has to be there on and on to supply nutrition to the tissue and carry the dirt or the byproducts back to the heart, and then pump it to the kidneys where it's washed out or accordingly. So there's an input and output. That's how the circulation goes. So if there is a problem in any of this, whether it's a big vessels or small vessels, circulation gets affected, then the tissue healing doesn't occur, because Amro's skin is not a piece of cloth that is there over our body. It is a dynamic tissue. It's continuously forming something, and it's also dying. So if you don't have blood supply, nothing new gets formed appropriately. So if there's a defective thing that's formed, then naturally the skin will be a problem, and ulcers will form, infections will come in. So that is what it is. If you talk about the nerve point of view, nerve, it'll be muscle moving, their motor is some nerves are nerves which move muscles. Sensory is for sensation. And so if the muscle power goes away, there will be deformities in the foot, like clawing of the foot. So that is clawing that occurs if small muscles in the foot lose their power or lose their function. And then instead of toe being straight, it starts going into a clawing situation. So when that is an abnormal position for the foot, so it takes up abnormal weight, and then you get ulcers, there ghau hune, yo sabi problem bhaira. And sensation is when sensation is very important for protection of a body. So fine touch, halka touch, that is important, so that if you get pricked by a needle, you withdraw your hand. So sensation, that is important. So if the sensation is lost, then you are prone for injury. So that happens in a diabetic patient. Or autonomic. Now, autonomic, this to understand is that is another section of a nerve which controls, say, on the skin, it controls sweating, the oil production on the skin. You must have noticed in diabetic patients that the skin becomes really dry. So when the skin becomes dry, then there are cracks on the skin. When there are cracks on the skin, that becomes the highway for the organism. So that area gets infected. So that is the reason why you need to take care of your skin, whichever part, whether you use moisturizing cream or whatever it is. So these are two contributing factors. It could also be a mixture of blood supply and nerves. So this is what you need to understand before you consider how you're going to take care of yourself. Can you go to the next slide, please? Now, I've put in hypomobility syndrome. All diabetic patients must have done blood for 𝐷𝐵A1C. Yeah, everyone knows about it. So that is nothing but glycosylation. So 𝐷𝐵A1C is glycosylation of the RBC, which carries the oxygen. Yeah, and that's what is checked. So the same thing happens, the same procedure, because of high sugar levels, affects the tissues in your body. So tissues in my body ma affect bhayo bhane the tissue chai stiff huncha ra joint ko the joints haru chai ko flexibility kam bhaera jन्छ, and त्यसले गर्दा पनि the problem that occurs with joint movement and instability of a joint. Other two problems that I talked about is the immunity. Diabetic patients ko immunity weak huncha. Why? Inside our body, we have cells, white cells. Right? So, in order to say, soldiers, they are soldiers to protect ourselves. So, what they have to do is they need to target an organism, eat it up, and destroy it. So, all three steps are defective in diabetics. So, chemotaxis is getting attracted towards a organism. Phagocytosis is engulfing it, the khanu. And cytotoxic environment, it has certain chemicals which destroys the organism. So there's a defect in diabetic patients about this. Another problem is if there are metabolic problems. Some people may have low protein levels, nutrition problems, albumin less than 2.5, or white cell count less than 1500. So all these are contributing factors to our defense mechanism and our susceptibility to develop diabetic foot. So you sabai gara, so kekele garna sakcha, nerve ko defect, blood supply ko defect, hypomobility, joint ko stiffness ko defect, immunity defect, र हाम्रो metabolic अनि protein low भएर पनि यो सबै कुरोले we become susceptible to the problem. Can we go to the next slide, please? Okay, so a few data to make you really feel why I'm talking about it. So 45 to 60% diabetic foot side, nasa ko nerve ko damage. it's a neuropathic problem. 45% is neuropathic and vascular both. So, यसबाट हेर्दा के देखिन्छ भने nerve injury is the commonest, vascular is less common, but it does occur. Can you go to the next slide, please? So 1% of diabetics, all diabetics, if you have 100 diabetic people in this group, you have one of them could say 𝗄𝐶को problem हुन्छ. 1% of diabetic will have 𝗗𝐶𝗏. यो 𝗗𝐶𝐏 भनेको के हो? I will show you the photo a bit later. So just remember this. This is not a very common thing, but it occurs. You would say nerve को damage भएर, because of damage to the nerve, the joints, there are multiple joints, there are joints in your foot which have to coordinate with each other. They do not coordinate. It's loss of proprioception, and they dislocate or sublux out, and they form a deformed foot. So that is called 𝗗𝐶𝐏. So the त्यो पनि एउटा, it's something that we have to be aware. 30% of diabetics who have neuropathy will have diabetic foot. त्यसको मतलब यो हो कि 100 जना डायबिटिक मान्छेहरुको से जसको चाहिँ नसाको ड्यामेज भइसकेको छ, उनीहरुको डायबिटिक फुट को प्रोग्रेसन हुन्छ. So they will have that. Can you go to the next slide, please? 15% of diabetics will develop lower extremity ulcer. So simple diabetes भएको मान्छेहरुको out of 100, 15 जनाको उनीहरुको चाहिँ खुट्टामा अल्सर हुन सक्छ. र 7 to 20% जसको चाहिँ अल्सर भएछ. सो 100 जना डायबिटिकको 15 जनाको डायबिटिक फुट, अनि out of this diabetic foot patients हरुको 7 to 20 जनाको patients हरुको अल्सर भएकोहरुको चाहिँ औंला या खुट्टा काटिनु पर्ने अवस्था आउन सक्छ. They may have to have an amputation at some point in life. So this is the reason. If you just look at the data, it is a small data, but when it happens to a person, it is 100% to the person. So important thing is identifying it early and taking care of it before anything happens to it. Can you go to the next slide, please? So how do you identify it? Simple things that you can see yourself. Sabai kuro गर्न सकिँदैन. There are certain kuro. Dry skin, your autonomic system, but a dry skin, cracks on your skin. So you need to be aware that you are at risk. Second kuro, if you are losing sensation, fine sensation over the sole of your feet. Now your 𝐬𝐶𝐻 monofilament भनेको यो पछि म फोटोजहरु देखाउँछु. Vibration sensation जानु र proprioceptive sense. Proprioceptive भनेको joint को sensation जानु. Muscle weakness भएर clawing हुनु, blood को supply त्यहाँ pulse नहुनु, र something called ankle brachial index. This is usually done by your doctor, so it will not be you doing it. It is the ratio between the systolic blood pressure in your arm and the systolic blood pressure in your ankle. It should be 1. So if it is less than 0.45, tissue healing hundaina. So these are, and then there is loss of hair. So the blood supply ko the earliest sign is आफूसँग खुट्टामा भएको जुन चाहिँ fine hair loss हुनु. So it just means that microcirculation has been affected. Microcirculation effect by when there will be pigmentation on the skin. So these are all signs, and if you are getting infection very easily, as infection boy, and then maybe in a month or so you're getting infection again. So that repeated problem by, and then you know that there is something going wrong, and you have to consider taking care, not only of your foot, but other parts of your body too. But foot is very susceptible to problems and injuries. Can you go to the next slide, please? So this is a type of this is a fine hair-like thing. When you press on the skin, it gives 10 grams of pressure. So we all need to be able to feel that light pressure. त्यति light pressure feel गर्न सक्दैन भने, then your body doesn't have the capability of protecting itself or taking your foot off something small, like even a pebble, that could cause injury to the skin. So your test, usually तपाईँको doctor, endocrinologist, whoever is taking care of your diabetes should be doing regularly of your foot. Lot of the endocrinology doctors they have a protocol. एउटा photo जस्तै हुन्छ पाइतालाको अनि the ball of the foot ma, little toe ko, heel ma, they will check for fine sensation. So this is something जुन चाहिँ डक्टर्सहरूले तपाईलाई गर्नुहुन्छ. So that's called 𝐬𝐴 monofilament. So next slide please. So मैले अघि ankle brachial index भनेको, this is also what your doctor will be doing. So the ratio between the ratio between the arm को systolic pressure and ankle को systolic pressure. So if it is less than point, normally it should be the same. दुईटैको तर ankle को systolic pressure घट्दै गयो र less than 0.45 भयो भने कुनै पनि घाउ चाहिँ heal हुन गाह्रो मान्छ. So it will be difficult for it. So when things like that occur, then we will need help from a professional, especially like a vascular surgeon, rather than a psychosurgeon. Can you go to the next, please? So all these, your diabetic foot, I will show you photos of this is a classification. And you're saying sequelae of events, how from mild inflammation to superficial ulcer to deep ulcer, osteomyelitis भनेको bone ma infection हुनु, abscess हुनु, and the toes becoming gangrenous and the foot becoming gangrenous. So these are few of the sequelae जुन चाहिँ हुन सक्छ in a diabetic person. So that's why I put up this classification. Ani, according to which stage you are, the treatment is decided accordingly, and that is usually done by your physician, of course. Next slide, please. So I'd like to put up, if you have a look at this foot, there's a bit of swelling, bit of redness. This is all you may get in the earliest sign. Just because a little bit of warmth, redness huncha, tato huncha, and there may be a bit of pain. It looks like it's infected. So it could start off with this simple low-grade infection. So त्यहाँबाट पनि all diabetic foot problems सुरु हुन सक्छ. Can you go to the next slide, please? So now you can see how the next ball of the foot. We all need to remember that our foot works like a tripod. भनेपछि over the ball of the foot one pressure huncha, over the little toe ko ball ma second pressure huncha, ra heel ma arko huncha. So 50% of pressure on the heel, 30% on the big ball, and about 20% on the little. So tinta aulama esari foot also. And the reason you can see the arch here is that hamro foot bhyatta parek way, if it was flat, that propulsive force sai ali hundaina. So nature has made a foot with this arch underneath here, and so naturally wherever the pressure, wherever there is pressure, that's where the ulcers will develop. So like this is the under the big toe or the little toe or the heel. That's where pressures can come, and that's where you can see the ulcer. It's a very superficial ulcer. त्यतिबाट पनि develop हुन सक्छ, and the patient or the person may not realize it at all. किनभने sensation नहुन सक्छ त्यहाँ. So that is a thing that you have to be aware. Can you go to the next slide, please? And now the ulcer is getting deeper. So that's how it goes in, and that yo यसरी deep भएर गएपछि त्यहाँ abscess हुन सक्छ. It can cause infection to the bone, and so these are the things that we have to be aware of, and try and get it out right in the early phases and try and identify it early to protect yourself. Can you go to the next slide, please? So this is more of a circulatory problem. So you can see 𝐸𝐴𝐿𝐸 early stages of gangrene, the toes can start becoming bluish, right? And then it becomes black, and once it has reached this stage, then it is a difficult stage. You can't go back. A lot of people will lose part of their foot. It will have to be amputated, and things like that can happen, and which is very dangerous. Next slide, please. Now, I was talking about sharked foot. Now we're talking about infection and everything, but deformity, how does the foot becomes this looks like a rocker bottom. Rocker bottom भनेको undersurface of a boat. So this is यो किन हुन्छ भने the joint sensation is lost and the bones start collapsing, the joint starts collapsing, अनि arch हुनुपर्ने उल्टा arch भयो. So यो भइदियो भने then the pressure, because the tip is towards the sole, so the pressure in that area going to be high, and त्यसले गर्दा you can develop infection, ulcers very easily. Charcot's, this is called a neuropathic foot. So it's a very difficult condition to treat properly. So it's important to identify, and you have to, we need special shoes to protect the foot of course. Can you go to the next slide, please? You can see how toes get gangrenous. The whole toe hasn't, it's only the upper part. Now this is an abscess, this is my own patient, but you can see how disastrous things can change if we don't. This patient came to me way late, I think 2 weeks later, or 2-3 weeks later, and the circumstances had changed. Can we go to the next slide, please? So literally you had to take anything dead has to be thrown to the bin. Okay, so everything had to be taken out. Let's go to the next. So as you see, if there is good blood supply, you can see the tissue healing up, and gradually, can you go to the next? Gradually it will heal. There are ways you may need, your doctor may even advise you for a total contact cast. It's a plaster like thing. So these things also, it does heal. It takes a long time, as long as circulation. So you can say blood supply to the foot is affected, and if the blood supply gets affected, then a vascular person will have to help you out. Vascular भनेको रगत जाने नसा, जस्तो हाम्रो हार्टमा हार्ट अट्याक हुन भन्दा अगाडि आजकल त एन्जियोप्लास्टी गर्छ, बाइपास गर्छ. So even in the leg मा पनि, if the blood circulation gets affected, you can do a bypass surgery and bring blood supply to the foot to try and protect what is left behind. Can you go to the next, please? Can we go back, please? Go back. So, so diabetic foot, once it has happened, is a difficult situation. And management of diabetic foot is not done by a single person. It is a team effort. Zoilipan team effort. You will need an endocrinologist to control your sugar. You will need, maybe if there are problems in your heart or your lungs, you can have retinopathy. Things to be aware is blindness, retinopathy. It can affect your eyes, can affect your foot. So you need an orthopedic surgeon, or if there has to be reconstruction, you need a plastic surgeon. If you need blood supply brought to it, you need a vascular person. If your foot is getting deformed, you need orthotics to make special shoes for you. Outside bairathira podiatrists saruncha. So you can see there, just for diabetic foot, there is the whole management is done on a team effort. So because it is a very difficult condition to manage and treat. So before this happens, before ulcers happen, before infections happen, we want to find it and identify it early. And how are you going to take care of your foot? That is what I will be talking about in my next slide. Can you go to the next slide, please? So prevention is better than cure. Awareness is important to be able to prevent it. Can we go to the next slide, please? This is a lovely picture of a child looking at his feet, but that is exactly what a diabetic person needs to do every night, at least, a couple of nights. You have to have a look on a regular basis. See that in the foot ko mathi you can see, but foot ko tala you cannot see. So if you are not able to look at the sole of your foot like this child, because the child is flexible, you can use a mirror, put it under your feet and have a look at it, because one fine day there will be loss of sensation and you won't realize it, um, and you won't realize it, and that is the time when there will be infection, ulcers to your feet, and once there are small ulcers that will progress on to bigger things. So you want to identify when something happens small. Do not, I would say for any person, and especially diabetic, even if you have the smallest of infection on your feet, do not take it lightly. Treat it and try and crush it right at the early stages. Can you go to the next slide, please? So looking at your feet, looking between your toes, that's where the diabetic people are susceptible to fungal infection. And this is exactly what can happen. You don't realize it. It can occur in your nails, can occur between your toes. So it's important to keep an eye on your feet on a regular basis. Can we go to the next slide, please? Augie, I did talk about also good tissue losing its tension and it's because of hypermobility. That's what happens. Amro, foot ko arch is controlled by the design of the bones. That is one side. And second kuro is ligaments leho ra, even by certain muscle. It's called tip post muscle. These things maintain the arch of the foot. Your curve of the foot is so important. So one of the commonest cause of flat foot is in an adult is because of the muscle weakness, tibialis posterior vansa. Current flat foot hunsa. So I do advise my patients who have flat foot to use an arch support. It's a very simple thing. Jutta bhitar rakhna milsa. A lot of the walking shoes that comes in, if you're using shoes, please see that you got a medial arch support. So jutta ko characters haru chai important. One is medial arch support. The second thing, the shoes ko sole should have a curve like the undersurface of a boat. It's called a rocker bottom sole. So if you have that, it's easier to walk. So it should be in your walking shoes. So that is important. Can you go to the next slide, please? So you can see ki Amro jutta should be nice and wide. You shouldn't be wearing narrow, tight. I mean, they may be beautiful, but they're not exactly good for your feet. And especially if you have narrow shoes with high heels, you're saying it's not exactly acceptable. And the chances of pressure sores, khutama hunu, and any pressure sore can lead on to infection and continuity or sequelae of events can happen. Next slide, please. So I put up this thing as, this is important for everyone, not only diabetic patients. We tend to cut at the edges. You should always cut your nails straight, 90 degrees, and edges, you should only file. Because if you start cutting on the edges, you get something called ingrowing toenail. Your nail starts growing and starts grabbing into the tissue below, and you will develop infection just at the edges of the nail. So this is also a very important technique to be aware of taking care of your foot, please. Okay. Next slide, please. So if you look at what I've written here, it's avoid what a diabetic, all diabetic, this is what I say at home. My mom's a diabetic and I put this across. I have a family of diabetes out here. So always avoid walking barefoot. Barefoot is an absolute no for a diabetic person because then you are susceptible to injury. Avoid flat and tight-fitting shoes, whether it's sandals or whatever, flip-flops or whatever it is. These are not good. Even these flip-flops are not good for diabetics. You should have more of a closed shoe. You should always wear closed shoe, Bansa. Wear soles that have a solid footing and don't slip. Thick soles, um, and there should be good amount of cushioning out there. Select a good quality podiatrist recommended shoe once. What I said that time was you need a medial arch support, a rocker bottom sole, and a wide toe box, comfortable, well cushioned shoes. So that's why I always say you can wear cheap clothes, but you should be wearing good expensive shoes, which not only for their beauty, but for the design of the shoe is absolutely vital, not only for diabetics, but even for normal people. Replace shoes when they show sign of wear. About flat foot, people who have flat foot, what happens with time is the front of the foot starts drifting outwards and the heel also starts drifting outwards. So the feet starts becoming like a C-shaped thing. So when a foot gets deformed that way, 𝐬𝐴𝐻𝐵, it also deforms the shoe. The shoe will resist it. They'll hold on to the shape for some time. But then gradually, as it becomes older, the shoe will also get deformed, and that is the time you have to consider changing your shoe. That is important. Practice good hygiene. Look for cuts, blisters, ingrowing toenails. Ingrowing toenails, I talked about when you cut the edges, the nail starts digging into your tissue and you get an ingrowing toenail and infection around your nails. So check feet every day for sores, any sign of infection such as redness, swelling, and pain. Next slide, please. So my take-home message would be these 8 things that I put across. Yeah. So a diabetic person should always wash their feet before going with soap and water before going to sleep. Dry your feet well, especially between your toes, because toes 𝗗𝗏𝐵𝐻𝐵 should be nice and dry. That's if it is wet, it's a source of infection, a source of fungal growth. Apply moisturizing cream on your feet, because diabetic patients the ability to produce oil in the skin is less. They have dry skin. So you should put moisturizing cream every day, especially in the winters. It becomes an issue. But please do not put moisturizing cream between your toes because it never dries up and that is a source of infection. Check your feet every day like the child did, or you can use a mirror to look at the sole of your feet. And then trim your nails in a 90-degree fashion and using a file at the edges. Change socks every day, and preferably it should be a cotton socks which is able to absorb the perspiration in your feet. Never walk barefoot, either indoors or outdoors. Ani, when you put on your shoes, examine your shoe inside. Sometimes there could be small pebbles or small, so you can have any grain. You keep your shoe outside. There could be grains of sand, or dust inside, and those small things are enough to irritate your feet and contribute to the starting of a major problem. So that is all I have to say. Can we go to the next slide? I think this is the end of my slide. I thank you all for listening to me. I hope this has been of some help. I've tried to make it as simple as possible, but please excuse me if I've talked about any medical terms a bit too much. It's just a bad habit, I would say. And I think that's all I have to say. And I'd like everyone to be aware of it and do share it with your own loved ones, and especially people who have diabetes, and to make them understand that there are lots of things. Diabetes affects us from head to toe. So there are lots of things in the heart, lungs, everything. Everyone takes care, but not to forget about our dear old feet, I would say, both sides. Thank you very much.
Thank you so much, Dr. Ranjitkar. Although we are short of time, is it okay if we take a few questions?
Yeah, not a problem, Joe.
So dear members, if you have any questions to Dr. Ranjitkar, the floor is all yours.
हजुर के थियो हजुर
I think Narendra sir has a question, Richie, in the chat box.
डाक्टर साहब
हजुर
म नरेन्द्र श्रेष्ठ हो मेरो क्वेसन के छ भने अहिले धेरै जसो यो पेशेन्ट पनि इभन इन्डोक्राइनोलोजिस्टहरुले पनि फुडलाई जति यो एटेन्सन दिनु पर्ने त्यति दिइराखेको देखिँदैन हामी अलिकति केयरलेस नै हुन्छौं है यो खुट्टाकोमा
हजुर हजुर
अब बाहिरतिर भनौं न दिल्ली नै जाँदाखेरि उहाँहरुको पुरा डायबिटिक प्याकेज हुन्छ यो खुट्टाको यो सबै यो फास्ट फुड देखि लिएर अनि केही गरी जुटामा समेत उहाँहरुले चाहिँ सोल मिलाउनु पर्ने त्यो सबै मिलाएर त्यो प्याकेजै हुन्छ हामी कहाँ त्यस्तो चाहिँ मैले कहीं देखेको छैन त्यसकारण हाम्रो हस्पिटलमा वा कहीं यो फुड सम्बन्धी यो प्याकेजहरु वा सोलहरु मिलाउने जुटाहरु मिलेको छ छैन हेर्ने पाइटलोलाई पुरा एक्जाम गर्ने त्यसो फेसिलिटी छ कि छैन हामीमा
अब शूज यो बनाउन यसको लागि त बनाउने अर्थोटिक डिपार्टमेन्ट हुन्छ त्यो चाहिँ कुपोर्नोलमा अर्थोपेडिका भन्ने ठाउँ छ त्यो जुन चाहिँ के भन्छ हनुमान थानको भित्रतिर त्यहाँ चाहिँ इफ सम कसैको चाहिँ स्पेशल शूज अब खुट्टा चाहिँ अलि बाङ्गेर गयो डिफर्म्ड भयो भने उनीहरुले चाहिँ जुत्ता मेजर गरेर बनाउनेहरु छन् त्यो अनि एक्जामिनेसन गर्नको लागि चाहिँ अब मैले हजुरले भन्नुभएको एकदम ट्रु हो त्यो पार्ट अफ अवेयरनेस चाहिँ कमै छ मैले यही प्रेजेन्टेसन मैले सेभरल टाइम्स गरेको छु 2-3 ठाउँमा एन्ड मेरो कुल घर जयसदेव हो त्यहाँ पनि मैले गरेको थिएँ यो डायबेटिक फुटको बारे अनि तर एज अ क्लिनिशियन मैले देखेको चाहिँ आई वर्क चाहिँ यता डाक्टर मिमिगिरीसँग आई वर्क विथ हर अहिले एन्ड उहाँको टिम चाहिँ उहाँको इफ यु लुक एट द फाइल जहिले पनि त्यो सोलमा चाहिँ मैले अघि देखाएको थिएँ त्यो फाइन टच हेर्ने त्यो चाहिँ जहिले पनि डकुमेन्ट गरिरहेको हुन्छ सो वेन दे पेशेन्ट्सहरु चाहिँ फलोअपमा आउँदा चाहिँ एभ्री टाइम चाहिँ भने एभ्री 3 मन्थ्स त गर्नु पर्दैन त्यो उनीहरुको एनुअल चेकअप बेला चाहिँ त्यो जुन चाहिँ हेल्थ चेकअप गर्छ नि फुल बडी चेकअप गर्दा ब्लड सब गर्दा त्यो फुटको चाहिँ चेकअप उहाँले चाहिँ गर्नुहुन्छ उहाँले गरेको मैले देखेको छु सो तर यस हजुरले डेफिनेटली अब फिजिशियनसँग जानुहुँदा यो कुरो चाहिँ कुरा उठाउन सकिन्छ अब त्यसको लागि यो सबै टिम एफर्ट हो हुन्छ डाक्टर मिमीले नै गर्ने हैन उहाँको नर्सिङ स्टाफहरुले गरेर फाइन टच गरेर यहाँ यो फाइन्डिङ्स यो छ भनेर डाक्टरले देखाउने त हो नि त्यो त त्यो सेन्सेसन हेर्न त जसले पनि गर्न सकिन्छ त्यो भेरी सिम्पल चीज हो सर उहाँले गर्नु भएको मलाई थाहा छ हजुर
थ्यांक यू डाक्टर साहब
I think Jeet uncle has a question as well.
हजुर
नमस्ते डाक्टर साहब
हजुर नमस्ते हजुर
एन्ड यो पहिलो दफा लाग्यो यो फुट ओन्ली को विषयमा चाहिँ कुरा भएको यत्रो वर्ष भइसक्यो डाक्टरहरुलाई देखाइराखेको हुन्छौं
हजुर हजुर
they don't actually I'm not blaming them
हजुर
they actually examine us but we also don't feel के त्यो तल खुट्टामा चाहिँ त्यति इम्पोर्टेन्ट हुन्छ
हजुर
जुत्ता लगाइराखेको हुन्छ मोजा लगाइराखेको हुन्छ त्यसपछि चेक गरेको हुन्छन् यताउति घोचघाच गरेर खुट्टा सुट्टा चेक गरेको चाहिँ देखेको छु
हजुर
बट नट इन दिस म्यानर
हजुर
यो तपाईले जुन चाहिँ एउटा कुरो चाहिँ मैले भनेको छु मैले चाहिँ के चाहिँ उ गर्दै छु भने एज ग्रुप
हजुर
would this actually apply to the youngsters or the infants
हैन यो त म डायबेटिक पेशेन्ट्समा भन्छु हैन हाम्रो अब एउटा अब यङ ग्रुप अफ इन्सुलिन डिपेन्डेन्ट डायबेटिक्सहरु त्यो त यङ ग्रुपमा एकैचोटी अर्ली स्टेज डायबिटिज आउन साथ त्यो नर्भ र भेसल्स डिस्ट्रोय हुँदैन नि त्यो ग्रेजुअली ओभर पिरियड अफ टाइम त्यो डिस्ट्रोय हुँदै जाने कुरो हो हैन सो जुन चाहिँ नन इन्सुलिन डिपेन्डेन्ट डायबिटिकहरुको चाहिँ ओभर पिरियड अफ टाइम हुनेकोले त्यो अलिकति सर्टेन एज भइसकेको पेशेन्ट्सहरुलाई अलि चान्सेस त्यो देखिन्छ त्यसमा यंगर ग्रुपमा नहुने हैन इफ suppose someone gets diabetes at say 25 once another 20 years भनेपछि 45 मा त you should be also considering something. So usually diabetes over a long period of time, the time of diabetes boys, सम्बन्धित चीज छ.
Thank you. And the अर्को question चाहिँ मलाई पनि यसरी चाहिँ problem हैन. Sometimes it becomes अलिकति हुँदाखेरि डक्टर्सहरुले फुड पाउडरहरु पनि रेकमेन्ड गर्छ र हामी लगाइराखेको हुन्छ, ठीक भइसकेपछि छोडिहाल्छौँ. यो फुड पाउडर लाउने स्थिति कुन बेला आउँछ? Is it the sign of the त्यो खालको
अब powder usually if there is a problem, हाम्रो चाहिँ त्यो powder चाहिँ fungal वाला हुन्छ के antifungal powders.
Right.
अनि if someone is suspecting that, they may be recommending it also, हैन. अब powder ले चाहिँ skin लाई it makes it dry नि हजुर, हैन. So हाम्रो the skin should not be as it is. It doesn't produce oil produce गर्दैन नि over period of time. हाम्रो हात र खुट्टाहरु एकदम dry हुन थाल्छ. So moisturizing cream is important to keep it nice and lubricated so that skin मा चाहिँ crack हुन दिनु भएन. So powder दिएको चाहिँ there must be a reason behind it, like अब toes को बीचमा छ भने त्यो fungal हुन सक्छ भनेर दिनु भएको होला त्यो कुरो, हैन. Antifungal powders हरु हुन सक्छ.
Right. The other thing is 90%, 90-degree cut भन्नुभएको छ नि डाक्टर साहब.
हजुर nails
को. Actually.
यो हजुरले nail यो यसरी, if you can see mine.
Right, right.
So यसमा त हाम्रो अलिकति curve छ नि, हैन. So
right.
In the toes ma चाहिँ you just cut straight, हैन.
Okay.
And then edges ma you will still have something poking out ni, हैन.
Right.
That's where त्यहाँ चाहिँ we tend to go and clip at the edges. So it is recommended not to clip at the edges, and then त्यसलाई filing गर्नु भन्छ, just smoothen out the edges and
right.
not किनभने हामी पुरै काटिदिए भने तलसम्म स्किन को मुनिसम्म काट्छौं अनि त्यो एरिया चाहिँ the nail starts, when it regrows, it starts digging in.
Okay.
हुन्छ अनि त्यो चाहिँ ingrowing toenails हुन्छ हजुर त्यसमा चाहिँ.
हामी hardly त्यो nail clipper use गर्दाखेरि I hardly use the files also. I love actually going into the corners with the clippers also. Now,
usually no, जति गर्यो त्यो it becomes a vicious cycle.
Okay. Thank you, Dr. Saab. That's my question. Dhanyabad.
Thank you.
So, doctor, there's also one more question. Does always having cracked feet indicate diabetes?
No. It's not the other way around. Cracked feet can be due to so many other things, right? So you know, the dermatologist will probably be able to explain in detail about skin problems. खाडी खुट्टा हिँड्ने धुलो त्यसले पनि feet crack हुन सक्छ. Diabetes ले contribute गर्न सक्छ, but it doesn't mean the other way around. Crack feet हुनस् त diabetes भन्न मिल्दैन.
Thank you so much, doctor. So, dear members, does anyone have any other questions? You can unmute and ask, or chat box मा हजुरले लेखेर टाइप गरेर सेन्ड गर्दा पनि हुन्छ.
I think that should be the end then. I know, Richie.
I think one more question, sir. I have a question actually.
हजुर.
त्यो जुन चाहिँ हजुरले सेमस वेइन्स्टिन मोनोफिलामेन्ट टेस्ट हजुर त्यो टेस्ट भन्नुभयो नि, is there any alternatives त्यसको लागि जुन चाहिँ हामीले घरमै बसेर पनि we can test?
अब the earliest sign of sensory loss, तीनटा important things. One is vibration, loss of feeling of vibration. Second is fine touch. Fine touch, you can also do it. Semestrin monofilament it gives you exactly 10 grams of pressure. I know you can also try and check it out with cotton, but it's not as accurate as the others. I know, but you can use a thick cotton and you can imagine 10 grams of pressure. You can so vibration, orco is proprioception, joint co sensation. That's a big toe. If I close my eye and someone moves my toe up, I can feel that my toe is up. Or I can feel that my toe is down even if I close my eyes, because my sensation nerves tell me. But people who start developing a risk will start losing this.
Thank you so much, doctor.
So
I
you
think
have 3 ways to assess these fine early signs.
thank you so much, doctor. I think Tonk Uncle also has a question. Uncle? Uncle, I think you're on mute, Uncle.
अहिले सुन्नुहुन्छ?
हजुर हजुर नमस्ते हजुर
नमस्कार डाक्टर साहब।
नमस्ते हजुर नमस्ते।
थ्याङ्क यू भेरी मच। हामीले थुप्रै कुरो सिक्नु पायो आज। एकदमै यो फुटको कुरो त कति धेरै रहेछ र सबै कुराहरू चाहिँ हाम्रो लागि साह्रै नै यो मेरो मात्रै सिक्न पाइयो। अघि जित दाइले भन्नुभयो जस्तो अनुसार धेरै टेस्ट त गरियो, तर यति डिटेलमा यति माइन्युट कुराहरू हामीले केयर नगर्दाखेरि धेरै पछि वर्स हुने कुराहरू समेत औँलाई दिनुभयो। मेरो आफ्नो केसमा एउटा सानो कुरा चाहिँ के हो, म डायबेटिक पेसेन्ट त होइन, तर मेरो जुन टो भन्नुभयो नि, त्यो दुइटै टो चाहिँ अलिकता क्ल जस्तो आइदर साइड यसरी आउट भएको छ। कुनै किसिमको मलाई पेन पनि छैन, कुनै इन्फेक्सन पनि भएको फिल त हुँदैन। कुनै सिम्टम हो कि यो पछि गएर मेरो टोलाई कुनै असर गर्छ कि डाक्टर साहब?
अब कस्तो हुन्छ नि, क्लइङ हुनु धेरै कारण छन्। डायबिटिज एउटा कारण हो हैन। नन डायबिटिक्सलाई पनि क्लइङ हुन सक्छ हैन। सो अब हजुरको क्लइङले के प्रब्लम गर्छ भने जुत्ता लगाउने बेला माथितिर प्रेसर गर्छ र पोइन्ट प्रेसर गर्छ हैन। पोइन्ट अनि त्यो ठाउँमा चाहिँ क्यालोसिटी स्किन थिकनिङ गर्छ। अनि हजुरले जुत्ता लाउँदा पेन भएर आउँछ त्यसमा हैन। अनि ग्रेजुअली यो इस्यु अब कति मान्छेहरूको चाहिँ क्लइङ थ्रु आउट देयर लाइफ, कतिको चाहिँ यो बुढी औँला पनि बाङ्गो, यो हेलक्स भाल्गस भन्छ, बाङ्गो भएर जान्छ। तर उहाँहरूलाई प्रब्लम छैन भने त्यसलाई के गरिहाल्नु पर्छ भन्ने छैन, त्यो एउटा कुरो हो। इफ हजुरलाई चाहिँ एउटा रिपिटेड इन्फेक्सन भइरहेछ या सु प्रब्लम्स भइरहेछ भने क्लइङको म्यानेजमेन्ट गर्न सकिन्छ हैन। क्लइङको म्यानेजमेन्टमा पहिलो चिज, फर्स्ट स्टेप इज wearing appropriate shoes. Appropriate wide shoes, walking shoes, cushion shoes हैन। सो क्लइङमा एकैचोटि 10 वटा चिज गर्नु सिम्पल, घरमा गर्न सक्ने चिज पहिला गर्नुहोस् हैन। अनि हजुरले त्यो गर्नु होला। त्यो सबै म्यानेजमेन्ट गर्नु भएर पनि हजुरको क्लइङले घाउ गर्यो, दुख्यो, प्रब्लम गर्यो, हिँड्न सकेन भने तब मात्रै एउटा डाक्टर या सर्जनले त्यो क्लइङलाई चाहिँ इम्प्रुभ गर्न सकिन्छ हैन। त्यहाँ तरिकाहरू छन्, त्यो तरिका अपनाउन द्याट इज द लास्ट अप्सन इफ हजुरलाई फुटमा प्रब्लम भयो। अब त्यो क्लइङ किन भएको छ त्यो एक्ज्याक्टली कति कुरो त किन हुन्छ हामीलाई थाहा पनि हुँदैन त्यो। एज लङ एज मेजर कजेस जस्तो डायबिटिज होइन या हजुरको कसैको चाहिँ नर्भको डिजिजेसहरू हुन्छ त्यस्तोमा पनि हुन्छ हैन। त्यो हुन्छ यो त्यसैले अब एक्ज्याक्टली हजुरको क्लइङ अलिकति भएछ भनेर के ठुलै डिजिज हो भनेर पनि सोच्नु हुँदैन हैन। किन हजुरलाई त यो भइरहेको त वर्षौँ भइसक्यो नि, हजुरलाई प्रब्लम दिएको छैन भनेपछि देन हजुरले त्यति वरी गर्नु परेन। हजुरलाई घाउ भएको छैन भने ठिकै छ, केही अप्ठ्यारो भयो भने सुज अप्रोप्रिएट लगाउनु होला। अनि त्यहाँबाट पनि भएन भने हजुरले आफ्नो डक्टरसँग कुरा गर्नु होला।
थ्याङ्क यू डाक्टर। लास्ट क्वेसन डाक्टर साहब, हजुरले कुपनडोलको जुन चाहिँ कानले छेउको पसल हुन्छ
अर्थोपेडिका भन्छ, उनीहरू चाहिँ एकदम पुरानो हो। अब म जुनियर डक्टर हुने बेला त्यो बेलादेखि उहाँले गरिराख्नु भएको हो। त्यहाँ चाहिँ युजुअली त्यो नक्कली खुट्टाहरू त्यस्तो यस्तो बनाउँछ। अनि कतिजनाको फुट प्रब्लम छ भने त्यो मेजर गरेर जुत्ता बनाउने या आर्च सपोर्ट बनाउने उहाँहरूले गर्नुहुन्छ। त्यो चाहिँ अर्थोपेडिका भने त्यो ठ्याक्कै हजुरले थाप्तली पुल नागेर पाटन राइट साइडमा कुपन्डल जाने यो के भन्छ सिखहरूको गुरुद्वारको गल्ली छ, त्यसको नेक्स्ट चाहिँ के भन्छ यो सर्वाङ्ग जाने बाटो छ, त्यो त्यसको बिचमा चाहिँ भित्र जाने बाटो छ। त्यहाँ चाहिँ हजुरले ठुलो बोर्डमा त्यो अर्थोपेडिका भनेर लेखेको हुन्छ उहाँहरूले धेरै कुरो त्यस्तो सानो सानो कुरो उहाँहरूले बनाउने भेरी इम्पोर्टेन्ट छ जुत्ताको हाम्रो खुट्टाको म्यानेजमेन्टमा अनि दे आर भेरी गुड राम्रो हुनुहुन्छ उहाँहरू अनि म धेरै पेसेन्ट्स उहाँहरूलाई नै रिफर गर्ने गर्दछु म
थ्याङ्क यू भेरी मच डक्टर साहब हजुर धेरै 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 कुरो ज्ञान भयो धन्यवाद हजुर
हस् धन्यवाद हजुर थ्याङ्क यू सो मच हजुर सो रिची द्याट्स इट Thank you so much, Richie. It was nice talking to you.
Richie, you're on mute, and I think someone has raised her hand. Last moment, my doctor, if that's okay with you.
Yeah, perfectly all right.
Asha ji le aatu thaunu.
Hazur. Hello. Namaste.
Asha ji ko.
I think you're on mute. You must be on mute.
Asha ji ko mute mai cha ahilesamma sign.
You're still on mute. Please click on the unmute sign. It says open queue. मैले के गर्नुपर्ने त हैन रिची? Open queue मा हैन है?
Asaji, if you have any questions, you can always send it to us. I think we're short of time as a college. So
I know if she want, no, because she's the last person.
She can. I think she can type it as well. Wako unmute.
Is there a problem?
No, I want to say thanks to you. Thank you so much.
Not a problem at all. It's nice hearing your voice.
Yes, and hope you know me very well.
Yes, I know you very well.
Thank you so much. I'm really happy to hear this. Thanks. God bless, doctor.
Yeah, thank you so much.
Thank you. Richie, thank you so much for coordinating with him so well.
Thank you so much, Asaji. Thank you.
Thank you. Bye-bye.
Bye-bye.
Bye, sir. Bye.
Sir, if in case any of our members would like to visit you, where can you be available, sir?
Well, I didn't mention it because it's like advertising. I don't want to. But I'm as I say, more Star Hospital Matsu. That's in Balku. And Arko is I'm in Ekantakunna. There's Helios Clinic. Dr. Mimigiri is an endocrinologist. She's a very good endocrinologist. And I go to her clinic 3 times a week. So that you do it at home.
Thank you so much, sir.
Thank you.
And thank you so much also for giving us your time. As a busy schedule.
Not a problem at all. It is always a pleasure.
And thank you. We would like to thank you for always being a part of our medical advisory board as well. If there are any other questions from our members, we will be sure to send it to you as well. And dear members, if you would like to ask any questions to doctor, you can always send it to us and we will be sure to refer it to him as well. So thank you all for joining today's session. We would like to wish you a great evening as well. So thank you so much, everyone. Have a nice evening.
Bye-bye. Namaste.